Hello, I am Kiku Sharada. To clear our doubts and raise awareness about COPD, let's invite a respiratory specialist. Let's get started. Doctor, help us understand COPD and its symptoms.
As we know, the name of the COPD itself, it says it's a chronic obstructive pulmonary disease. It's an obstructive pulmonary disease. So it ultimately leads to a decrease in the diameter of the bronchus and the airways. So this actually has two things. One is the chronic bronchitis and emphysema. The main symptoms are usually shortness of breath, recurrent lung infections, patient getting cough, increase in the amount of the expectorations. The patient may develop recurrent fatigueness. So these are actually the symptoms of COPD about it.
What are the causes of COPD and can COPD be cured?
What are the causes of COPD? One of the most common cause of COPD right now is the smoking. But other than the smoking, the pollution. Right now, just we have read that the air quality of Delhi NCR is as good as the person who are having the smoking around. So normal dust, smoking, or industrial pollutants, or we can say motor vehicular pollutants. So right now, every one of us are actually exposed to develop a COPD if you are living in a polluted environment. So as you cannot control the breath, so obviously it cannot be cured. Yes, the symptoms can be controlled with the help of medications and regarding that, but all the Indian population is at present actually prone to develop the COPD right now.
Doctor, share some tips on COPD management or treatment.
Management and treatment of the COPD. The main treatment of it starts with you can say inhalation therapy. You can use with the bronchodilators, you can use inhaled steroids. Right now, many of the patients are just not willing to go for the inhalation therapy. They think that they get addicted to it, but I am telling you, it is one of the best addictions to have your inhalers with you. So treat that. Avoid getting recurrent infections. Avoid going close to the near person who will have the URTIs or something like that. Treat it properly. Visit your doctors regularly. The newer things which are developed right now is the pneumococcal vaccines or influenza vaccines that you can take in that thing. That's why you can avoid getting recurrent infections. And if the symptoms are very severe, you can definitely have a home oxygen therapy or portable oxygen cylinders with you, and that way you can improve a little bit of your quality of lifetime. But the main thing is that avoidance of the dust, avoidance of the pollutant, trying to living in a healthy environment is the mainstay of the treatment of the COPD.
Thank you, doctor, for your time and detailed explanation. I urge everyone to be aware of this issue and take care. Thank you for listening.